In this lesson, we're going to take a look at stages of infection. Now, when we look at illness or infection, we have to recognize that it happens in stages. It's like this continual timeline. It basically goes in a forward direction. It's not just like you're exposed and then you get sick and then everything is cool. And by understanding these stages, it actually helps you to anticipate care a little bit better for your patient. If we think about it this way, it actually helps you to make predictions. It's, for instance, if you have a patient like who's in the hospital and just starting to show symptoms of hospital-acquired pneumonia, you can anticipate providing like lots of supportive respiratory care. The other thing you want to think about is that sometimes you can get to one stage and then bounce back and regress. And we're going to talk about that a little bit later. So you can actually go back and forth between different stages. So let's get started. This is the incubation stage. This is the very first part. This is a timeline from the first time you are exposed to a bacteria or virus to the very first symptom. So we're going to use strep throat as an example, seeing as both my kids right now have it, and I had it a ton as a kid, so I'm a pro when it comes to strep throat. The incubation period for strep is like 2 to 5 days. So if a patient was exposed, let's say Saturday, then they might actually start to feel kind of crummy on like maybe Monday or Tuesday or Wednesday. So it's the first time from the first symptoms. So they may start to like, I'm tired. I don't feel well. I feel a little bit under the weather. So that's your incubation stage. Then you have something called the prodromal stage. This is your second stage. So this is from the time the general symptoms show up to the symptoms that are specific to this illness. So let's go back to strep. So they have strep and you can just general feeling of like malaise. So in that in the incubation stage, you may have like a low grade fever. So in this stage, this is where rapid multiplication occurs. And so you're going to get, for your strep patient, you're going to have, hey, they definitely have a sore throat now, right? And they definitely have a solid fever. So like, let's say it's like 100 degrees or higher. So those are going to be there like, hey, these things look more like a specific illness. That's what prodromal is about. It's about looking more like a specific illness or disease. Then you have full-blown illness. This is like, hey, we are super duper sick. I've got swollen lymph nodes. I've got swollen tonsils. I've got, for the strep patient anyway, I've got a fever that's unrelenting and it's not responsive to antipyretics. So those are things like ibuprofen or Tylenol, things that bring down a fever. Like, this is where, hey, I have to go to the doctor now. I have to go see maybe my PA or my NP. I have to go get a throat swab. I got to go get testing, and I'm going to need some antibiotics. I am not going to get better with this without illness or without being seen by the doctor. Flu is kind of one of those things. I mean, this is not a very this is not a one size fits all. This is just kind of a generalization using strep as an example. So like the flu, that you're not going to necessarily have that. You're going to have, hey, I'm full blown symptoms. I'm having muscle aches. I'm having fever. This is definitely the flu. This is definitely this illness. So that's what the illness stage is about. And so the next stage, which is convalescence, and we're going to talk about that, is kind of when it starts to come down. So like I talked about with convalescence, this is when the symptoms actually begin to get better. So, hey, my fever broke for your strep patient, right? So now you have your fever breaking, right? And then you could have your decreased sore throat. The dysphagia, if you had any dysphagia, so difficulty swallowing, any dysphagia would actually start to improve. That's for the strep patient. This is what this would look like. But for some illnesses, I mean, these may take days, they may take months, they may take years to get better. Big important point I want to point out is that recovery can fail. So you can have like this incompletion of antibiotics. So you start to, hey, this is why the patient education comes in. You say, hey, I need you to finish your antibiotics. And they go, sure. Right. They're supposed to be taking them for 10 days. They take them for 5 days, thinking they can hang on to those 5 days. Well, here's what happens is that you can actually go back. This is where I talked about you can actually regress. So now, instead of being here, we're actually going back to this illness stage. So now, because you didn't finish your antibiotics, you're actually sick again. And now we have to go take you back to the doctor or back to your healthcare provider. And we got to get you more antibiotics. We got to change antibiotics. We got to do cultures now. We got to do all these other things. We're prolonging your improvement. So make sure that your patients are being educated. Finish your antibiotics. If you're on antibiotics, finish them. That way they know that they can actually, they can get past this convalescent stage to get back to baseline. The other thing too is, incompletion of antibiotics can actually contribute to antibiotic resistant bacteria. So this is where we have this big problem where we get these super bugs coming in because people aren't completing their antibiotics. So if they're on an antibiotic, make sure they finish them. Make sure you're educating your patient on it. Understanding how the infection stages influence our care, it helps us to understand our nursing concepts quite a bit better. So today we focused on safety by prioritizing what may happen with our patient, and also we focused on infection control. So let's recap. Incubation is when the patient is first exposed to any sort of bug, and you get your first general symptoms. So again, this can be like malaise, tired, just general feeling bad. So that's going to be your incubation period. So that's that time frame. The prodromal stage is when you have the time from the general symptom to the very, very specific symptom. One thing I do want to mention is that this prodromal stage can be very, very short. So you can have, oh, hey, I feel it's really crappy, and you go to bed, and then all of a sudden you wake up, you're like, oh, I just feel absolutely terrible. In that little, 4, 6, 8 hour window, whatever you had that was in the prodromal stage, you're now gone to the illness stage, which is your full blown illness and a classic telltale symptom. So for people like strep, sore throat, fever that's unrelenting, difficulty swallowing, your tonsils are inflamed, sometimes white pustules on them, you definitely need to go to the doctor. This is when we gotta go see the doctor. Convalescence, it's when your symptoms are starting to get better. Remember, things can change. You can actually have your patients that bounce from the illness, go back and forth between the illness stage and the convalescent stage. So make sure that your patients are finishing their antibiotics, or finishing their medication, and make sure they're staying compliant with it. Don't save them for later, because they can actually prolong it, and then you're actually wasting the money. So, and lastly, the thing to remember is that things can change. You can have patients that can go all the way to the convalescent stage, and then because they didn't finish their antibiotics, they end up bouncing back to this illness stage. So make sure that your patients are being educated, to make sure they understand that they can actually prolong their illness by not completing their therapy and making sure that they're compliant. So that's a really important thing that you want to drive home. And that's our lesson on stages of infection. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.